who asked the question? Downstairs?
Downstairs.
The cost of tort reform, of litigation, according to various studies, is between 1 and 4% of the increase in health care. About 1 to 4%. So it isn't this massive thing that is all of a sudden said skyrocket. It's about 1 to 4%. Here's two other very interesting statistics, one on each side. 3 out of 4 cases, according to one study, says of the cases brought forward are actually fraudulent. Yet, only one of every 10 that could be brought forward are ever brought forward. So you have facts on both sides of the table. What I believe is the right answer, and it's not in this bill, but what I have proposed, and I will continue, is I believe, as I said, if everybody has their data points, if a young boy at 6 years old has a bad surgery because of quadriplegic, to cap it at $250,000, which is about $6,000 for the rest of his per year for the rest of his life, really isn't fair. Well, I think what you should have is precedents where the jury is told, like in constitutional law or in bankruptcy court, this is normally what happens when a leg is wrongly amputated. But then, people can say, well, wait a minute, they forgot the anesthesia when they did it in this case. Well, it's different. And therefore, precedence isn't always the determinant. But I strongly believe in a country whose laws, Chris and I both defend, and we have different viewpoints substantively, but it's a nation of laws, and I believe individuals should have their day in court. And that's kind of what I believe.
Thank both of you for your service. I appreciate your service to the country. You're right, I disagree with you completely. I read 1,017 pages also, and I'll tell you, 2/3 of it, nobody knows what it means because it refers to other parts of the legal code. Unless you got 1,000 law books, you don't know what those other pages mean either, sir. And I was never better than a corporal. I respect your 08 grade, but you don't know what's in all of that bill. So let me ask you, you brought up that the public option would be so much less expensive than the private option. My employer has 29,000 employees. I work really hard. I teach an adult education class when I get off work at jails and rehabs for no money. But yet I'm painted as the right-wing extremist in this room. I go out and volunteer all the damn time for stuff that matters to me. I want the insurance I have because I picked it. I picked it, it covers me, it covers my daughter, it covers my wife, and I pay for it. How can you tell me that the private option will stay in place when my employer with 29,000 employees can just turn around tomorrow and say, we're writing that off the bottom line, you guys are all going to the public option.
I think Chris brings up an excellent point. Because when I went throughout Pennsylvania, what I found is, in this, particularly, if you don't mind, Chris, just for a moment, and I'll tell you how it does that. In this savage recession, I mean, I found everybody. And I do not, as I've said on TV repeatedly, find that it's the far right that has angst or anxiety. I found it with everybody. Because, my gosh, look where we've ended up somehow. And government, what did you do to make sure that we didn't get here? And all of a sudden, people are holding on to either their job or health care. And you know what? We haven't at times done as well as we should have, if you believe. And you and I have sat down one-on-one and had discussions, all right? To done the job of how to explain to someone who has worked his heart out, saved this country, was in Somalia, Black Hawk Down. And now wait a minute, how can you assure me you're not going to mess this one up? Which is what his question was.
I was in Panama, not Somalia.
I thought you had Somalia. Sorry. It's just the same. Sorry. Integrity. Here's how it does. It mandates that the employer has to keep the health care plan he has.
Section? What section?
I brought it here.
Because it does.
This is my health care plan. I've read. And he's right. Adam Exler, where are you? I have told him repeatedly, when the amendments and other things come out, that he calls up, I call him and I say, if I'm up here reading the bill or down here, and say, what's this referred to in which section? But it actually, and I will send you the exact section that mandates employers must continue their health care plan, except for those small businesses I told you down there, that get a choice of which ones they go into. If they don't, because mind you, 14,000 people a day are losing their private health care plan now. And large employers too small are just not being able to afford it. And this is a concern. Outside of the public health, mind you, the public health care plan option, Chris, and I know you may disagree with what I say, but it is the fact, is a choice. It's a choice, nothing more. And it mandates, and I will be happy to show you in the book, right? I'll show it to you, Chris. Hey, Adam.
It doesn't mandate me to keep my insurance, it just says my employer can do it. It's not
Yes,
me.
yes. But he has to cover you. Now, you don't have to. If you want to not take that, that's permissible. But that's your choice. You don't have to, but he has to cover you, it says. I could do, hey Adam, can you show him right now where it is? If you won't mind, go ahead and sit over. I think you can find it.
Congressman, we're going to go over here to Liz.